Hey everybody, welcome back to Health Matters. This is brought to you by Cipla. I am your host, Ryan O'Connor. Welcome to another episode of Health Matters South Africa. And we're joined once again by the phenomenal Dr. Zenda, widely known as Dr. Gynae, Joburg-based OB-GYN, sexologist and founder of the We See You. It's a great movement. As a fellow of the European Committee of Sexual Medicine, Dr. Zenda continues to break stigmas and, of course, lead transformative conversations around women's reproductive health across South Africa. Good day to you, Dr. Zenda.
Good day, Ryan. How are you doing, sir?
I am fantastic. There's a definite change of season in the air. And we're talking of change of seasons in this episode, in actual fact. We're tackling that season that impacts every woman. Menopause and premenopause, from hot flushes to hormone replacement therapy, or HRT as it's known, natural approaches, even osteoporosis prevention. We'll unpack what really happens during this transition and how women can take control of their health and well-being. Now, first, let's get straight into it. What's the difference between perimenopause and menopause?
So, excuse me, Ryan. Menopause is a definitive diagnosis, although it is retrospective in the sense that a woman knows that she has menopause after she has missed 12 consecutive menstrual cycles. And this happens at an average age between about 48 and 52 years of age. Perimenopause is, on the other hand, the time before this happens. And this is very erratic in the sense that it's different for every woman, and it can be anything between 8 to 10 years prior to them actually menopausing. And this is because the whole crux of menopause is as a result of that decline in our superpower hormones, the estrogen, progesterone, and testosterone, but particularly the estrogen. And this doesn't happen as an incident or as like a once-off event. It's something that gradually starts happening from around the ages of about 35. So you'll find women sort of like in their early 40s starting to feel some kind of symptoms, even though they may still be having their menstrual period, but something they can feel in their body has changed. And this is what we call the perimenopausal period.
Right. Now, what are the most common symptoms that a woman experience during this?
Right. So there is, and this is so important because not every woman will experience every single symptom of menopause. And I like to think of it from head to toe. One of the big things that what we call the vasomotor symptoms, this is what affects your sleep. So they get hot flashes, they get disturbance in their sleep, they experience insomnia, but also they may experience brain fog, which is something that basically affects their cognitive functioning. Then you come to their bodies, the metabolic rate starts to decrease quite significantly. So you get that increased amount of fat that deposits around the waist, particularly if they're not very active. And then you get what we call the vasomotor symptoms. The genitourinary symptoms. This relates to everything in affecting the urinary system and the genital system, and that could be increase in urinary tract infections, the bacterial vaginosis, the yeast infections as well. They get vaginal dryness, which may make sexual intimacy also very uncomfortable. The other one that's really big that we don't see as often, but we only see it as a symptom, is osteoporosis. Yes, some ethnic demographics are more prone than others, but basically it's this corrosiveness or the erosion of the bone density, and that leads to a risk in fractures. So those are pretty much some of the big ones. Of course, there are subtle ones, things like, the hair loss, the change in skin, the dryness, and all those things. But usually those are the big ones that we are looking at. The risk of cardiovascular disease also becomes a big deal. So the metabolic syndromes and the lifestyle diseases starts to creep in, things like diabetes, hypertension, a risk of stroke. Those become high risk during this time as well.
Right, doctor. So we spoke about HRT. How does HRT work and who is it suitable for?
Right. So hormone replacement therapy is for the patient that is complaining of symptoms of menopause. And I think it is good to understand that first and foremost, not every woman will experience every symptom. And secondly, I always encourage clinicians to individualize the symptom with the correct treatment. So particularly women who are struggling with things like the hot flashes, the women who are struggling with things like the dryness, vaginal dryness in particular, very often HRT is good for them. But also we have to individualize it in the sense that we have to look at the person in terms of their medical or past medical condition, current medical condition, their history. So for example, somebody who's either been predisposed to blood clots, somebody who's been predisposed to breast cancer in particular, or has a family history, we often try and shy away from necessarily using HRT. But also what we see a lot more often is a lot of women may not necessarily be comfortable with hormonal therapy. So it's always important to look at what are the symptoms a person is having. If all a person is having is genitourinary symptoms, they don't have hot flashes, they are fine in that regard, you can actually counsel them into using just either a very a localized hormone replacement, so like a cream or what we call a dermal kind of cream that they can use, as opposed to taking a full-on hormone replacement therapy. Also, and I think we'll probably touch on this as well, is hormone replacement therapy is not the only thing that is available there.
Yes.
And so it becomes important to give your clients all the information about what they need, what else they can take other than hormone replacement therapy.
Absolutely. And to that point, what natural or lifestyle approaches can help manage these symptoms?
I always say lifestyle it is probably, first and foremost. And I encourage women all the time, start looking after yourself before you get to this phase, because it's a lot harder. So there is no such a thing as move more and eat less type of scenario. It's just always making sure that you have a balanced diet. Whatever you take in, you must be able to kind of burn out kind of thereabout. But also, to that, you're not just looking at the diet or the exercising or physical activity from a perspective of, you must do like these, extreme cardios. The most important thing is put in what we call strength training, because that then helps with the weight issue, but also it helps with making sure that you don't lose out on, you don't erode your bones, the bone density, you keep your bone density as much as possible. Also, strength training, what it does is it preserves your muscle mass, which generally starts to decline as well. You start losing a lot of that muscle mass the older you go. This helps with the way that your metabolism works, but also, again, it helps with things like just your mood. Mood is another big symptom when it comes to menopause. Women are more prone to things like anxiety, depression around this time. So, exercise doesn't just only cater for the weight purposes. Then you get things like supplements. Supplements are also great, from your vitamin D to your calciums. These are good for your, for your bone and bone structure. But also you get, phytoceutics, what basically are like natural or plant-based stuff that it kind of mimics the way that estrogen works. And therefore, you take away the risk of using a synthetic estrogen, and you kind of use something that is more natural. Other things that are very helpful, I always say, in your 40s, that's the time, if you haven't found it yet, that's the time to find your joy, to find your purpose, to find the things that make you happy. So things like meditating, things that really bring that, that center you. We've seen, for example, when you look at like the research, cognitive therapies and meditation and things like that, they definitely do have a place in terms of just helping you. And then there are things which I call like just be street smart as well. When it is like a winter or you're going to the office, layer your clothes. I've seen women carry these fans, for example. These are things that I say you anticipate yourself so that it's not this miserable phase or transition that you're going through. When it comes to things like sexual intimacy, for example, lube all the time. There's nothing wrong with using a bit of lube. And most importantly, I think probably something that is more therapeutic than we realize, make sure that one, you have a clinician that you can have a conversation about these things and you are not embarrassed to chat about, whether it's urinary incontinence that suddenly come up, whether it's the mood symptoms, whether it's the sexual things, but also have a group of people around, a support structure around you, whether it's your partner, your family, where you actually explain what you're going through so that people are not sitting there thinking, oh my gosh, the monster has come out and something is, you going crazy. And I think that's one of the biggest issues where a lot of women feel like they're misunderstood, they're dismissed when they kind of talk about these symptoms.
Now, Doc, how and why? Let's first of all talk about why. Why is osteoporosis prevention so important at this stage?
It is really so important because throughout your lifespan, you're building up this bone density and it kind of stays intact, provided obviously, you've got a healthy diet. And then you get to 35, like I said, 35 years, women have a finite reproductive phase, or that period where they can reproduce. And what generally happens is, like I said, it starts to decline slowly and estrogen forms a really big part in that bone structure. And so you are risking, if you're not taking the supplements, you're not checking your bone density and not preventing osteoporosis, the risk is much higher of having fractures, of having also, and I think where it becomes a problem is that even when you end up with osteoporosis, whether you end up with a fracture, whether you end up with osteoarthritis, and you end up needing like big operations like hip replacement, it is much more riskier and it carries a much more of a mortality rate as compared to you having looked after yourself, your bones in particular, in this case, throughout. So prevention is absolutely like really, really important. We need to be encouraging and reminding women about these things. Start taking supplements. Your estrogen will inevitably decline.
Doctor, this is now, I guess, the final question, and probably one of the most important as well, is how can women support their mental and emotional health during menopause?
Yeah. This is a big one because it is and this is where what we call multidisciplinary comes in. We spoke about the right support system, the ability to talk about what's going on, but also having a clinician that you're able to talk about. And if it really, and again, it goes back to treating what is going on. So if there is anxiety, if there is depression, please do go see a mental health clinician, whether it's a psychiatrist, a psychologist. And when I say multidisciplinary, it's also to understand that sometimes you get sort of like collating things, whether it's a stressor, whether it's, life happening, that will impact how you're processing your mental health. And so if you are in the menopausal age or perimenopausal age, and there are all these things happening, managing stress becomes such an important part of it. So there's definitely an area where a psychiatrist, a psychologist can get involved, but there's also so much more that you can do in terms of how you manage your stress levels, the support system that you have, the treatment that also your gynae can give you in terms of the hormone replacement therapy. That does also improve your mental well-being as well.
What an insightful episode and podcast this has been. Remember, just if you want to recap it all, menopause is a natural life stage. It is not an illness. Perimenopause can start years earlier, so awareness is key. Multiple options exist in the space. HRT, lifestyle changes, natural approaches. Osteoporosis, as we've just mentioned, prevention is essential, obviously, for long-term health. And finally, and most importantly, no one should ever feel like they have to suffer in silence. Support and solutions are available. And we've got the great guidance, as for always, from our specialist online with us, Dr. Zenda, Dr. Gynae. Thanks again for your amazing time, your insightful chats that have become just a wonderful part of my week and everybody else that's been enjoying the series together. It's been a highlight for a lot of us. So thanks for your time again, Doc. We look forward to chatting again soon.
Yeah, always a pleasure, Ryan. I keep saying you definitely need to be advocate for women's health because you do such a fantastic job. Thank you so very much.
Thanks for joining us on another episode of Health Matters brought to you by Cipla. Don't forget, subscribe to our YouTube channel. All the content is there from Health Matters SA. We've got some incredible content with Dr. Zenda and myself. More episodes and obviously conversations that put your health first. Empower yourself with knowledge. I can't tell you enough about that. Make informed choices. And remember, your health at every stage of your life is your right. Have a good one, and we chat again soon.